Marcus Thompson had always been the kind of man who fixed problems with his own two hands. At 62, he still carried the broad shoulders and calloused palms of someone who had spent 40 years working construction sites across the city. His reputation preceded him wherever he went: reliable, hard-working, and stubbornly independent to a fault. The chest pains started on a Tuesday morning in October. Marcus was installing kitchen cabinets in a downtown apartment when a sharp, burning sensation spread across his chest like wildfire. He gripped the edge of the counter, his breathing becoming shallow and rapid. The pain radiated down his left arm, and beads of sweat formed on his forehead despite the cool autumn air filtering through the open windows. "Just pulled something," he muttered to himself, rolling his shoulders and trying to shake off the discomfort. Marcus had experienced his share of aches and pains over the decades. A herniated disc from lifting heavy beams, a torn rotator cuff from a fall off scaffolding, and countless minor injuries that came with the territory. This felt different, but he pushed the thought away. His work partner, Tony, noticed Marcus leaning heavily against the wall. "You all right there, boss?" Tony had worked with Marcus for 15 years and knew when something was wrong. "Fine, just need some air," Marcus replied, wiping his brow with the back of his hand. He stepped outside onto the small balcony, hoping the fresh air would clear his head. The pain gradually subsided, but a nagging worry remained in the back of his mind. That evening, Marcus sat in his favorite recliner, watching the evening news with his wife, Sarah. She had been his high school sweetheart, and they had built a life together that revolved around family, hard work, and simple pleasures. Sarah noticed he was quieter than usual, picking at his dinner and shifting uncomfortably in his chair. "You've been rubbing your chest all evening," she observed, her nurse's instincts kicking in. Sarah had worked at the local hospital for 25 years before retiring, and she knew the signs of cardiac distress better than most. "It's nothing, probably just heartburn from that spicy sandwich at lunch," Marcus dismissed her concern, but Sarah wasn't convinced. She had seen too many men his age ignore warning signs, convinced that acknowledging weakness was somehow a personal failure. Over the next few days, the episodes became more frequent and intense. Marcus found himself stopping mid-task, clutching his chest while waves of pain washed over him. He started keeping a small bottle of antacids in his tool belt, telling himself it was just stomach trouble brought on by stress and poor eating habits on job sites. The breaking point came on Friday afternoon. Marcus was on a ladder, installing ceiling fixtures in a commercial office space, when the most severe pain yet struck like a lightning bolt. The world spun around him, and his vision blurred at the edges. His hands trembled as he gripped the ladder, fighting against the overwhelming urge to let go and collapse. Tony was below, holding the ladder steady, when he heard Marcus's sharp intake of breath. "Marcus! You're white as a sheet, man. Come down from there right now." Marcus slowly descended the ladder, each step feeling like a monumental effort. By the time his feet touched the ground, he was drenched in sweat and struggling to catch his breath. The pain in his chest felt like a vice tightening with each heartbeat. "That's it, we're going to the hospital," Tony declared, already reaching for his phone to call an ambulance. "No." Marcus's voice was more forceful than he intended. "No hospitals. I just need to go home and rest. Sarah will know what to do." Tony looked skeptical but knew better than to argue with Marcus when his mind was made up. He helped Marcus to the truck and drove him home, staying until Sarah arrived from her grocery shopping trip. One look at her husband's pale, clammy appearance told Sarah everything she needed to know. "Marcus, we need to get you to the emergency room right now. This isn't heartburn, and you know it." "I'm not going to any hospital," Marcus replied firmly, settling into his recliner with obvious discomfort. "Hospitals are where people go to die. I've seen too many guys my age walk into those places and never walk out. I'll be fine with some rest and maybe one of your home remedies." Sarah felt a familiar frustration rising in her chest. She had dealt with stubborn patients during her career, but having her own husband refuse medical care was infinitely more challenging. She knew that men of Marcus's generation often viewed seeking medical help as an admission of defeat, a sign that they were no longer capable of taking care of themselves. "This isn't about being tough, Marcus. This is about being smart. The symptoms you're describing could be serious heart problems. If you won't go willingly, I'll call an ambulance myself. Marcus's jaw tightened. You do that, and I'll refuse to go with them. You can't force a man to get medical treatment he doesn't want. The standoff continued through the weekend, with Marcus experiencing several more episodes of chest pain. He stubbornly refused to acknowledge the severity of his condition, instead focusing on small household projects he could manage from his chair. Sarah watched helplessly as the man she loved slowly deteriorated before her eyes. On Sunday evening, after a particularly severe episode that left Marcus gasping for air and clutching his chest for nearly 10 minutes, Sarah made a decision. She called her daughter, Jennifer, who lived across town with her 2 teenage children. Your father is having what I'm certain are heart problems, but he refuses to go to the hospital. I need your help convincing him. Jennifer arrived within the hour, her face etched with concern. She found her father in his workshop, slowly organizing tools with shaking hands. The color had drained from his usually robust complexion, and she could see the effort it took for him to complete even simple tasks. Dad, Mom told me what's been happening. Please, just go get checked out. For all of us who love you. Marcus looked up at his daughter, seeing the worry in her eyes that mirrored his wife's. For a moment, his resolve wavered. Then, he straightened his shoulders and returned to his organizing. I appreciate your concern, sweetheart, but I know my own body. This will pass, and things will get back to normal. I've survived worse than this. Jennifer spent 2 hours trying to reason with him, sharing stories of people who had caught heart problems early and lived full, healthy lives because they sought treatment promptly. Marcus listened politely but remained unmoved. By Monday morning, Sarah had reached her breaking point. She called Marcus's primary care physician, Dr. Rodriguez, who had been treating the family for over a decade. Dr. Rodriguez agreed to make a house call, something he rarely did, but he understood the unique challenges of treating patients who refused to come to the office. When Dr. Rodriguez arrived that afternoon, he found Marcus in his garage, pretending to work on his vintage truck. The doctor's trained eye immediately noticed the shallow breathing, the pale complexion, and the way Marcus favored his left side. Marcus, your wife is worried about you, and, frankly, so am I based on what she's described. Let me just listen to your heart and check a few things. No commitment to go anywhere, just a quick examination. Marcus reluctantly agreed, more out of respect for the long-standing relationship than any desire for medical intervention. Dr. Rodriguez's examination revealed an irregular heartbeat, elevated blood pressure, and several other concerning signs that pointed to significant cardiac issues. Marcus, I've known you for 10 years, and I've always respected your independence and judgment. But, I'm telling you as both your doctor and your friend, you need immediate cardiac evaluation. These symptoms suggest you could be having ongoing heart problems that could become life-threatening without proper treatment. Marcus listened to the diagnosis with growing resistance. Doc, I appreciate you coming out here, but hospitals are where they experiment on you and keep you trapped with machines and tubes. I've seen what happens to men my age who get caught up in that system. I'd rather take my chances at home with people who actually care about me. Dr. Rodriguez spent another 30 minutes trying to address Marcus's fears and misconceptions about modern cardiac care, explaining the advances in treatment and the high success rates for patients who receive timely intervention. Marcus remained polite but unmoved. After Dr. Rodriguez left, promising to check back in a few days, Sarah felt more isolated and frightened than ever. She spent the evening researching cardiac symptoms online, becoming increasingly convinced that her husband was experiencing a slow-motion heart attack that could prove fatal if left untreated. That night, as Marcus slept fitfully beside her, Sarah lay awake planning her next move. She had exhausted the usual channels, family, friends, and medical professionals had all failed to convince Marcus to seek treatment. She needed a different approach, something that would speak to him in a language he could understand and trust. The idea came to her suddenly, born from her years of experience in hospital settings and her intimate knowledge of her husband's personality. Marcus respected expertise and competence, particularly from people who had proven themselves through experience rather than just education. He trusted individuals who demonstrated practical knowledge and genuine concern without condescension or pressure. Sarah remembered stories from her nursing days about particularly challenging patients who had finally accepted care when approached by specific staff members who somehow connected with them on a personal level. There were certain nurses who had a gift for reaching resistant patients, often through shared experiences or common backgrounds that created an instant bond of understanding. As Tuesday morning dawned, bringing with it another episode of chest pain that left Marcus weakened and short of breath, Sarah made her decision. She would try one more approach, but this time she would be strategic about who delivered the message and how it was presented. Marcus's condition was deteriorating, and time was running out. If her plan didn't work, she would have to consider more drastic measures, even if it meant temporarily damaging her relationship with the man she had loved for over 40 years. But, first, she would try to find someone who could speak to Marcus in a way that honored his dignity while saving his life. Tuesday afternoon brought the crisis Sarah had been dreading. Marcus was in the backyard, attempting to fix a broken fence post despite her protests, when the most severe episode yet struck him like a freight train. Sarah heard his strangled cry from inside the house and rushed outside to find him collapsed on his knees, one hand pressed against his chest while the other clawed at the ground for support. His face had turned an alarming shade of gray, and his breathing came in short, desperate gasps. Sweat poured down his face despite the cool October air, and his eyes held a look of panic that Sarah had never seen before in their 43 years of marriage. "Marcus, talk to me," she called out, dropping to her knees beside him. His only response was a weak groan as another wave of pain crashed over him. His body trembled violently, and Sarah could see his lips beginning to take on a bluish tint. For a moment, Marcus's eyes met hers, and she saw something that broke her heart: fear. The man who had never backed down from any challenge, who had faced down workplace bullies and natural disasters with equal determination, was terrified. But, even in his terror, she could see him fighting against the idea of surrendering control. "I'm calling 911, Sarah announced, already reaching for her phone. "No," Marcus managed to whisper through gritted teeth. "No, hospital." "You don't get a choice this time," Sarah replied firmly, her voice steady despite the panic clawing at her chest. She dialed emergency services while keeping one hand on Marcus's shoulder, feeling the tremors that ran through his body with each labored heartbeat. The emergency dispatcher's voice was calm and professional. "911, what's your emergency?" "My husband is having what appears to be a heart attack. He's 62, experiencing severe chest pain, shortness of breath, and he's pale and sweating profusely. This has been going on for about 10 minutes. Is he conscious and breathing?" "Yes, but barely. He's been having chest pains for over a week and has refused medical treatment. We're dispatching an ambulance to your location immediately. Try to keep him calm and still. Don't give him any medication unless specifically directed by a doctor." Sarah stayed on the line while the dispatcher provided instructions for monitoring Marcus's condition. Within 8 minutes, she heard the wailing of sirens approaching their quiet suburban street. Marcus had managed to shift into a sitting position against the fence, but his breathing remained labored and his color hadn't improved. The paramedics arrived with practiced efficiency. The senior paramedic, a woman in her 40s with graying hair and kind eyes, immediately took charge of the situation. Her partner, a younger man with military bearing, began unpacking their equipment with swift, precise movements. "Sir, I'm Linda, and this is my partner Jason. We're here to help you. Can you tell me your name?" Marcus looked up at her with defiant eyes. "I didn't call you people. I don't need your help." Linda knelt beside him, her voice remaining calm and reassuring despite his resistance. "I understand this isn't what you wanted, but your wife was scared for you, and, frankly, looking at you right now, I can see why. Your color is poor, you're sweating, and you're clearly in significant distress. We need to check a few things to make sure you're stable." "I'm fine," Marcus insisted weakly, though the words lacked conviction even to his own ears. Jason had already begun setting up monitoring equipment while Linda continued talking to Marcus in a steady, non-threatening voice. She had clearly dealt with resistant patients before and understood the psychology of men who viewed medical intervention as a personal defeat. Your wife tells me you work construction. That's tough work. I bet you've dealt with your share of injuries over the years. Linda's tone was conversational as she positioned an oxygen monitor on his finger. Marcus nodded slightly, some of his hostility fading in response to her respectful approach. The thing about heart problems is they're not like a broken bone or a pulled muscle. You can't just tough your way through them. The heart is a muscle, but it's a special kind of muscle that needs constant blood flow to work properly. When that flow gets interrupted, even tough guys like you can be in serious trouble. While Linda continued her gentle explanation, Jason had attached EKG leads to Marcus's chest and was studying the readout on their portable monitor. Sarah could see his expression grow more serious as the data appeared on the screen. Linda, we need to move quickly, Jason said quietly, his tone carrying an urgency that made Sarah's stomach clench with fear. Linda glanced at the monitor and her demeanor shifted subtly from reassuring to businesslike. Marcus, your heart rhythm is very irregular right now, and that's not something we can treat here in your backyard. We need to get you to the hospital where they have the equipment and medications to help stabilize you. No, Marcus said again, but his voice was weaker now, and Sarah could see the fight going out of him as another wave of pain struck. Marcus Thompson, Linda said firmly, using his full name to capture his attention. I've been doing this job for 22 years. I've seen men just like you die in their driveways because they were too proud to accept help when they needed it. I've also seen men just like you walk out of hospitals a few days later to go home to their families because they were smart enough to let us do our job. She paused, letting her words sink in before continuing. Your wife loves you. Your family needs you. Don't make them watch you die because you're afraid of looking weak. Getting medical help when you need it isn't weakness, it's wisdom. Marcus looked over at Sarah, who was standing nearby with tears streaming down her face. For the first time since this ordeal began, he seemed to really see how much his stubbornness was hurting the people he loved most. What exactly would they do to me at the hospital? He asked, his voice barely above a whisper. Linda sat back on her heels, sensing that this was the crucial moment. First, they'll run some tests to figure out exactly what's happening with your heart. Blood tests, maybe an EKG, possibly some imaging. If you're having a heart attack, they have medications that can dissolve blood clots and procedures that can open blocked arteries. The sooner they can intervene, the better your chances of a full recovery. Jason had been preparing the stretcher while Linda talked, and now he moved closer. The pain you're feeling right now could mean your heart muscle is being damaged by lack of oxygen. Every minute we wait increases the risk of permanent damage. Marcus closed his eyes, fighting an internal battle between his fierce independence and his growing recognition that this situation was beyond his control. Sarah approached slowly and knelt beside him, taking his clammy hand in hers. Please, Marcus. I can't lose you. Not like this, not because you were too stubborn to let people help. Our grandsons need their grandfather. I need my husband. When Marcus opened his eyes, Sarah could see that something fundamental had shifted. The terror was still there, but it was now mixed with resignation and, perhaps even a small measure of relief at finally surrendering the burden of fighting this battle alone. If I go, he said slowly, looking directly at Linda, can my wife stay with me? I don't want to be alone in some sterile room with strangers. Hospital policy varies, but, in emergency situations, they usually allow family members to be present during initial treatment. I can't make promises about every step of the process, but I'll make sure they know how important it is to you. Marcus nodded weakly. Okay. But I want to walk to your ambulance. I'm not riding on that stretcher like some invalid. Linda exchanged a quick glance with Jason before responding. I understand the dignity issue, but your heart is already under stress. Walking could make things worse. How about we compromise? You sit on the stretcher, and we'll raise the back so you're in a more upright position. You'll still have some control over the situation. It took another few minutes of negotiation, but eventually Marcus agreed to be transported. As the paramedics secured him on the stretcher, he reached out and grabbed Linda's arm. That hospital, they're not going to do anything to me without explaining it first, are they? I need to understand what's happening. That's absolutely your right as a patient, Linda assured him. You have the right to ask questions about any treatment they recommend. No one can force you to consent to procedures you don't understand or don't want. The ride to Metropolitan General Hospital took 12 minutes through afternoon traffic, with Jason driving smoothly while Linda continued monitoring Marcus's vital signs. Sarah rode in the front passenger seat, turning around frequently to check on her husband, who seemed to be breathing a little easier with the oxygen mask in place. During the transport, Marcus's condition remained stable but concerning. His heart rhythm continued to show irregularities, and his blood pressure readings indicated significant cardiovascular stress. Linda radioed ahead to the emergency department, providing them with detailed information about his symptoms and current status. Metropolitan General, this is Unit 47. We're transporting a 62-year-old male with acute chest pain, diaphoresis, and cardiac arrhythmia. Patient has been symptomatic for approximately 1 week but refused treatment until today. ETA 4 minutes. The response came back immediately. Unit 47, Bay 3 is ready for you. Cardiology team has been notified and is standing by. As they pulled into the ambulance bay, Marcus could see the hospital's emergency entrance through the small window. The building looked imposing and sterile, reinforcing all his fears about modern medical facilities. But Linda's steady presence and professional confidence had begun to chip away at his resistance. Remember what I told you, Linda said as they prepared to transfer him to the emergency team. These people are experts at what they do. Trust them, ask questions when you don't understand something, and focus on getting better so you can go home to your family. The emergency department doors slid open automatically, and suddenly, they were in a world of bright lights, bustling activity, and the subtle but unmistakable smell of antiseptic that Marcus associated with illness and death. His anxiety spiked immediately, and Sarah could see his hands gripping the sides of the stretcher. It's going to be okay, she whispered, squeezing his shoulder as they wheeled him toward the treatment area. But, even as she said the words, Sarah wasn't entirely sure she believed them herself. She knew they had crossed a threshold from which there was no turning back, and everything that happened from this moment forward would be in the hands of people they barely knew. The emergency department at Metropolitan General Hospital buzzed with controlled chaos. Medical staff moved with practiced efficiency between treatment bays, their conversations a mixture of medical terminology and urgent directives that sounded like a foreign language to Marcus. The antiseptic smell was stronger here, mingled with the faint odors of coffee and the underlying anxiety that seemed to permeate hospital emergency rooms. Marcus was wheeled directly into Bay 3, where a team of medical professionals was already waiting. The attending physician, Dr. Sarah Chen, was a woman in her early 40s with sharp, intelligent eyes and an air of quiet authority. She approached the stretcher with a clipboard in hand, her expression serious but not unkind. Mr. Thompson, I'm Dr. Chen. I understand you've been experiencing chest pain for several days. We're going to take good care of you, but I need you to help us by answering some questions about your symptoms. Marcus's jaw tightened as he looked around the treatment bay. The walls were lined with medical equipment he didn't recognize, monitors displaying scrolling numbers and wavy lines that meant nothing to him. 2 nurses were already preparing supplies while a technician positioned a portable X-ray machine nearby. I don't want a bunch of tests I don't need, Marcus said, his voice hoarse but defiant. Just give me something for the pain and let me go home. Dr. Chen pulled up a stool beside the stretcher, positioning herself at eye level with Marcus. I understand this is overwhelming, but the chest pain you've been experiencing could indicate several different problems. Some are minor and easily treated, others could be life-threatening. The only way to know which we're dealing with is to run some tests. What kind of tests? Marcus asked suspiciously, eyeing the various machines surrounding his bed. We'll start with blood work to check for enzymes that indicate heart muscle damage, an electrocardiogram to look at your heart's electrical activity, and a chest X-ray to examine your heart and lungs. These are standard, non-invasive tests that will give us a picture of what's happening inside your body. Sarah stood nearby, watching the interaction with growing anxiety. She could see Marcus's resistance building again, despite the obvious severity of his condition. His color remained poor, and she noticed that he kept pressing his hand against his chest even while talking to the doctor. One of the nurses approached the stretcher with a small tray of blood-drawing supplies. She was young, probably in her mid-20s, with blonde hair pulled back in a ponytail and a nervous energy that immediately put Marcus on edge. "Sir, I need to draw some blood for the tests Dr. Chen ordered," the nurse said brightly, reaching for Marcus's arm. "No," Marcus said firmly, pulling his arm away. "I didn't agree to any tests yet." The young nurse looked confused and glanced toward Dr. Chen for guidance. "But, sir, we need these tests to help you." "It's just a small needle stick." Marcus's expression hardened. "I said no. I don't know you people, and I don't trust you. For all I know, you're going to stick me full of holes and run up a bill that'll bankrupt my family." The atmosphere in the treatment bay became tense. Dr. Chen stepped forward, clearly accustomed to dealing with difficult patients, but Marcus's hostility was more intense than the typical resistance they encountered. "Mr. Thompson, I understand your concerns, but your symptoms suggest you could be having a heart attack. If that's the case, every minute we delay treatment increases the risk of permanent heart damage or death. These tests are necessary to determine the best course of action." "Heart attack," Marcus scoffed, though his voice lacked conviction. "I've been working hard my whole life, and my heart's never given me trouble. This is probably just stress or something I ate." Dr. Chen pulled out her phone and showed Marcus a diagram of the heart. "Your heart is a muscle that requires constant blood flow through arteries called coronary arteries. When those arteries become blocked by blood clots or fatty deposits, part of the heart muscle begins to die from lack of oxygen. That's what causes the chest pain, sweating, and shortness of breath you've been experiencing." Marcus studied the diagram but remained skeptical. "How do I know you're not just trying to scare me into paying for a bunch of expensive procedures? I've heard stories about hospitals doing unnecessary surgery just to make money." The young nurse made another attempt to draw blood, but Marcus jerked his arm away again, more forcefully this time. "I told you no. Don't touch me without my permission." Dr. Chen could see that her usual approach wasn't working with this particular patient. She had dealt with resistant patients before, but Marcus's combination of fear, mistrust, and stubbornness was proving particularly challenging. She was about to try a different tactic when another nurse entered the treatment bay. The new arrival was markedly different from the young nurse who had been attempting to draw blood. She was older, probably in her early 50s, with graying brown hair and weathered hands that spoke of years of hard work. Her uniform was neat but not pristine, and she carried herself with the quiet confidence of someone who had seen it all during her career. "Sorry I'm late," she said to Dr. Chen. "Just finished with a difficult case in trauma." "This is Mr. Thompson?" Dr. Chen nodded, looking relieved. "Yes, and he's being resistant to basic diagnostic procedures. Maybe you could." The older nurse raised a hand to interrupt politely. "Let me talk to him." She approached Marcus's stretcher with unhurried steps, her manner calm and non-threatening. "Mr. Thompson, I'm Barbara. I've been working in this emergency department for 28 years, and I've probably seen every kind of patient and every kind of problem you can imagine." Her voice carried a slight accent that Marcus couldn't place, but it sounded genuine and unpretentious. Marcus looked at her suspiciously but didn't immediately object when she moved closer to the stretcher. "I can see you're scared and frustrated," Barbara continued. "Being in a hospital when you don't want to be here is frightening. All these machines and strangers poking at you, it's not natural for someone who's used to being in control of his own life." Something in her tone made Marcus's defensive posture relax slightly. Unlike the other staff members, she wasn't trying to convince him of anything or rushing him toward decisions. She was simply acknowledging his feelings without judgment. "I've raised 4 kids and helped take care of my elderly parents," Barbara went on. "I know what it's like to be responsible for other people and to feel like you can't afford to be sick. But sometimes our bodies don't ask permission before they break down." Marcus found himself listening despite his determination to resist. Barbara pulled up a chair and sat down, making herself comfortable as if she had all the time in the world. "Can I tell you something about the people who work here? Most of us didn't get into medicine for the money. We certainly didn't get into emergency medicine for easy hours or comfortable working conditions. We're here because we genuinely want to help people, even when those people don't particularly want our help. She gestured toward Dr. Chen and the other staff members. Dr. Chen has been working for 14 hours straight today. She's missed her daughter's soccer game and probably won't get home to see her kids before they go to bed. The only reason she's staying here talking to you instead of going home is because she's worried about you. Marcus glanced at Dr. Chen, who was updating his chart while keeping one eye on his monitor readings. For the first time, he noticed the fatigue around her eyes and the coffee stains on her white coat that suggested a long, difficult shift. "Look," Barbara said, leaning forward slightly. "I'm going to be honest with you about something most hospitals don't like to advertise. We have what we call a code around here for patients like you, good people who are scared and don't trust the system. We call it code independence." Marcus's eyebrows rose slightly. "Code independence?" Barbara nodded seriously. "When we encounter a patient who values their autonomy above everything else, we adjust our approach. Instead of pushing you toward decisions, we give you all the information and let you choose your own path. But here's the thing, we still have to present you with accurate information about your condition." She paused, watching Marcus's reaction carefully. "The blood work Dr. Chen wants to do will tell us if you're having a heart attack right now. The EKG will show us if your heart's electrical system is functioning properly. These aren't invasive procedures, they're diagnostic tools that give us information. What you do with that information is ultimately up to you." Marcus considered this for a moment. The idea that he could maintain some control over the situation made the prospect of testing less threatening. "And if the tests show something serious? Then, what?" "Then, we explain your options clearly and honestly. Some treatments are time-sensitive, meaning they work best if started quickly. Others can be delayed while you think about them. But you'll know exactly what you're facing and what choices you have." Dr. Chen stepped forward, having listened to Barbara's explanation with approval. "Mr. Thompson, what Nurse Barbara is describing is called informed consent. It means you have the right to understand every aspect of your care before agreeing to any treatment. We're not going to force anything on you, but we need baseline information to know what we're dealing with." Sarah, who had been standing quietly in the corner, felt a surge of hope. For the first time since arriving at the hospital, she could see Marcus actually considering cooperation rather than simply resisting everything out of principle. "The blood draw takes about 2 minutes, Barbara explained. The EKG involves placing small, painless electrodes on your chest for a few minutes. The chest X-ray is just like having your picture taken, except it shows us your internal organs. None of these procedures will hurt you or put you at risk." Marcus looked around the treatment bay again, but this time his expression was thoughtful rather than hostile. The monitors continued their quiet beeping, and other patients could be heard in nearby treatment areas, some talking quietly with their families, others resting comfortably. "If I agree to the tests," Marcus said slowly, "and they show something's wrong with my heart, are you going to pressure me to have surgery or other major procedures right away?" Barbara and Dr. Chen exchanged glances before Barbara answered. "If the tests indicate you're having an active heart attack, we'll strongly recommend immediate treatment because the window for effective intervention is very narrow. But, even then, you have the right to refuse treatment. However, we'll make sure you understand the likely consequences of that decision." Marcus closed his eyes and took several deep breaths. The chest pain that had been his constant companion for days seemed to be getting worse despite the oxygen mask, and the fear in Sarah's eyes was becoming harder to ignore. "All right," he said finally. "Let's do the tests. But I want my wife here with me, and I want every step explained before you do it." "Absolutely," Dr. Chen agreed immediately. "Barbara will coordinate the testing, and we'll make sure you understand everything that's happening." As Barbara prepared the blood-drawing equipment with practiced efficiency, she continued talking to Marcus in her calm, reassuring voice. "You know, some of the strongest people I've ever met have been construction workers. It takes real courage to work on high buildings and with heavy machinery every day. This is just a different kind of courage, the courage to let other people help you when you need it. Barbara worked with gentle precision as she drew Marcus's blood, her movements confident and sure. Marcus watched her every action, still wary but no longer actively fighting the process. Sarah stood beside the stretcher, holding his free hand and providing silent moral support. "There we are," Barbara said, placing a small bandage over the needle site. "That wasn't so bad, was it? The lab will have results in about 30 minutes. The EKG procedure followed quickly, with Barbara explaining each electrode placement and what the resulting tracings would show. Marcus found himself oddly reassured by her matter-of-fact explanations and the way she treated him like an intelligent adult rather than a difficult patient. When the chest X-ray technician arrived with the portable machine, Marcus was prepared for the procedure and cooperated without protest. The whole testing process took less than 15 minutes, far shorter than he had imagined. "Now we wait," Dr. Chen explained. "I'll be back as soon as we have results. In the meantime, try to rest and let us know immediately if your chest pain gets worse." As the medical team dispersed to tend to other patients, Barbara remained behind to monitor Marcus's condition. She adjusted his oxygen mask and checked his foreline before settling into the chair beside his stretcher. "Can I ask you something?" Marcus said, his voice muffled slightly by the oxygen mask. "Of course. That code independence thing you mentioned, is that really a thing, or were you just trying to make me feel better?" Barbara smiled, and, for the first time since entering the treatment bay, her professional composure softened slightly. "Can you keep a secret?" Marcus nodded, intrigued despite himself. "It's not an official hospital code," Barbara admitted. "It's something a few of us older nurses came up with over the years for dealing with patients who remind us of our own stubborn family members. We've learned that some people need to feel like they're making choices rather than having decisions forced on them." She glanced toward the curtain that separated them from the busy emergency department beyond. Dr. Chen and I have worked together long enough that she trusts my judgment about patient psychology. When I see someone like you, intelligent, independent, scared but trying not to show it, I know that the usual medical approach isn't going to work." Marcus absorbed this information with surprise and something approaching gratitude. "So you were basically manipulating me into cooperating?" "Not manipulating," Barbara corrected gently. "Adapting our approach to match your personality and needs. The medical care we're providing is exactly the same whether you're a cooperative patient or a difficult one. But how we present that care can make all the difference in whether you accept it." Their conversation was interrupted by Dr. Chen's return, carrying a clipboard with test results. Her expression was serious but not alarming as she pulled up a stool beside Marcus's stretcher. "Mr. Thompson, your blood work shows elevated levels of troponin, which is an enzyme released when heart muscle is damaged. Your EKG indicates some irregularities in your heart rhythm, and the chest X-ray shows mild signs of fluid retention around your heart." Marcus felt Sarah's hand tighten around his. "What does all that mean in plain English?" "It means you are indeed having a heart attack," Dr. Chen explained carefully. "It appears to be what we call a slow-onset heart attack, which explains why your symptoms have been building over several days rather than hitting you all at once." The words hit Marcus like a physical blow. Despite his suspicions and fears, some part of him had still hoped that his symptoms were caused by something minor and easily treatable. The reality of having an actual heart attack made his situation undeniably serious. "Am I going to die?" he asked bluntly, looking directly at Dr. Chen. "Not if we treat you promptly and appropriately," she replied with equal directness. "The damage to your heart muscle appears to be moderate but not severe. However, you're at risk for further complications if we don't address the blocked arteries that are causing the problem." Barbara leaned forward slightly. "Remember what we talked about, you have choices here. Dr. Chen is going to explain your options, and you can decide what feels right for you." Dr. Chen nodded and consulted her notes. "We have several treatment options. The most effective approach would be cardiac catheterization, which is a procedure where we thread a thin tube through an artery in your arm or leg up to your heart. We can then see exactly where the blockages are and potentially open them with balloon angioplasty or place stents to keep the arteries open." Marcus's expression darkened. "That sounds like surgery."
It's considered a minimally invasive procedure rather than surgery, Dr. Chen clarified.
You'd be awake during the procedure, which typically takes 1 to 2 hours. Most patients go home within 24 to 48 hours afterward.
What if I refuse? What are my other options?
Dr. Chen's pause was brief but noticeable. We can treat you with medications designed to dissolve blood clots and reduce the workload on your heart. This approach is less invasive but also less effective, particularly for the type of blockages your EKG suggests you have. Barbara added, the catheterization procedure has a very high success rate and allows doctors to fix the problem directly rather than just treating the symptoms. It's what most cardiologists would recommend for someone in your situation. Marcus looked at Sarah, whose face reflected the same fear and uncertainty he was feeling. They had been married long enough to communicate without words, and he could see that she was trying to be supportive while fighting her own terror at the thought of major medical procedures.
How long do I have to decide? Marcus asked.
The sooner we intervene, the better your chances of a complete recovery, Dr. Chen replied. Ideally, we'd want to perform the catheterization within the next few hours. However, you're stable right now, so we have some time to discuss your concerns. Over the next hour, Marcus peppered Dr. Chen and Barbara with questions about every aspect of the proposed treatment. He wanted to know about risks, success rates, alternative approaches, and long-term outcomes. Both medical professionals answered his questions patiently and thoroughly, never pressuring him toward a particular decision. During this discussion, Marcus learned that Dr. Chen had performed hundreds of similar procedures, that the hospital's cardiac catheterization lab was among the best in the region, and that patients with this type of heart attack typically return to normal activities within a few weeks of treatment. Barbara shared stories of other patients she had seen go through similar procedures, focusing on positive outcomes while being honest about potential complications. Her years of experience lent credibility to her reassurances, and Marcus found himself trusting her judgment more than he had expected. The turning point came when Dr. Chen's pager buzzed with an urgent message. She excused herself to handle another emergency, leaving Marcus alone with Barbara and Sarah. I'm scared, Marcus admitted for the first time, his voice barely above a whisper. Of course you are, Barbara replied matter-of-factly.
Anyone would be scared. Being scared doesn't make you weak, it makes you human.
Sarah squeezed his hand. I'm scared too, but I'm more scared of losing you because you were too afraid to get treatment. Barbara stood and moved closer to the stretcher.
Marcus, can I tell you something personal? He nodded. My husband was a firefighter for 32 years. Tough as nails, never met a challenge he wouldn't face head-on.
When he started having chest pains at age 58, he ignored them for 3 weeks because he was afraid of being seen as weak or broken. She paused, her expression becoming distant as she remembered. By the time I finally convinced him to come to the hospital, he had suffered so much heart damage that his recovery took months instead of weeks. He had to retire early, and he never quite got back to being the strong, active man he had always been. Marcus listened intently, sensing that this story had a deeper meaning. The thing that haunted him for years afterward wasn't the heart attack itself, Barbara continued. It was the knowledge that if he had sought treatment earlier, he could have prevented most of the damage to his heart. He spent the rest of his life wondering what might have been different if he had put his family's needs ahead of his pride. The treatment bay fell silent except for the gentle beeping of monitors and the distant sounds of hospital activity. Marcus stared at the ceiling, processing Barbara's words and wrestling with his own fears and preconceptions.
Your husband, Marcus asked quietly. How is he now?
He passed away 2 years ago, Barbara replied gently. But not from his heart. He lived 15 good years after his heart attack, got to see his grandchildren grow up, traveled with me to places we had always dreamed of visiting. The procedure that saved his life gave us 15 years we wouldn't have had otherwise. When Dr. Chen returned 30 minutes later, she found Marcus sitting up straighter and looking more resolved than when she had left. Doctor, Marcus said before she could speak.
I want to do the catheterization procedure. But I have some conditions.
Dr. Chen sat down, prepared to negotiate.
What conditions?
I want Barbara to be part of my care team throughout the procedure. I want my wife to be able to stay with me as much as possible. And I want regular updates during the procedure so I know what's happening. Those are all reasonable requests that we can accommodate, Dr. Chen assured him. Barbara is one of our most experienced cardiac nurses, and we often have her assist with catheterizations for patients who need extra support. Barbara smiled and patted Marcus's shoulder. I'd be honored to be part of your care team. We'll get you through this, and then you can go home to finish that fence repair project. 2 hours later, Marcus was being wheeled toward the cardiac catheterization lab, with Barbara walking beside his stretcher and Sarah following close behind. His fear hadn't completely disappeared, but it had been replaced by a sense of determination and hope that he hadn't felt since his symptoms began. The procedure itself went smoothly, with Dr. Martinez, the interventional cardiologist, successfully opening 2 blocked arteries and placing stents to keep them clear. Marcus remained awake throughout the procedure, asking questions and receiving reassuring updates from Barbara, who had indeed been assigned to his care team. 3 days later, Marcus walked out of the hospital under his own power, carrying discharge instructions and a new appreciation for both his own mortality and the dedication of medical professionals. Barbara was there to see him off, having checked on him daily during his recovery. Remember, she said as they reached the hospital exit, you've got a second chance here. Use it wisely. 6 months later, Marcus returned to the hospital for a follow-up appointment with Dr. Chen. He found Barbara working her shift in the emergency department and stopped by to thank her for saving his life. You didn't just use medical skills on me, he told her. You used something more important. You understood what I needed to hear and how I needed to hear it. That code of yours, that way of treating stubborn patients like people instead of problems, that made all the difference. Barbara smiled, the same warm, genuine expression he remembered from their first meeting. That's not really a secret code, Marcus. That's just good nursing. Sometimes the most important medicine we can provide is respect, understanding, and a little patience with human nature. As Marcus left the hospital that day, walking confidently toward his truck with clear breathing and strong steps, he reflected on how close he had come to losing everything because of his own fear and pride. The rookie nurse's secret code had saved his life, not through any special medical technique, but through the simple recognition that healing sometimes begins with understanding the patient's heart and mind, not just their physical condition.